So right now I will present content for how. Okay, my title is types of therapy for autistic children. Okay, please enjoy. Okay, so you can aware about autism. Okay, the first type of uh, therapy for autistic children is called ABA. Okay, what stand for ABA? Apply behavior analysis therapy. Okay, apply behavior analysis, yeah, is a type of therapy in which therapists will initiate the procedure by understanding the patient behavior and then changing it. Okay, not only understanding the patient behavior, the therapist in ABA or apply behavior analysis therapy will teach new skills to patients. Okay, from the increase in these skills, the behavior that tends to be negative from the patient can be reduced or changed later. Several types of skill that the therapist will teach and guide in patients with autism are the first one, improve language skills, so that children's communication with other people is better and smoother. Okay, second skill, therapist teach for ABA patients, is improving ability to manage children's behavior, especially in situation of social interaction. Okay, and the third therapy for ABA patient, is enabling children to learn to take care of themselves. Okay, the therapist will be very patient during this therapy process, one of which is teaching children to understand and be able to follow verbal instructions. In addition, the therapist will teach children to read and write, imitate the movements and speech of others, respond to calls or words of others, and describe an object. ABA is a type of therapy will be assisted by certified therapists, so this teaching program must be implemented by a professional in the field. Even if parents or teachers want to apply this method, they need to go through training first from the expert so that they can implement it properly. If you want to know more details about ABA therapy, it's important to consult a doctor who treats your child directly. Okay, the second type autism therapy is called occupational therapy. What does it mean? Occupational therapy? It's a type of therapy that is able to help people with mental disorders, physical limitation, to disorders of cognitive abilities. This therapy generally must be under the supervision and assistance of medical rehabilitation specialists. This treatment will enable children with autism to be able to carry out normal daily activities like other children. Occupational therapy will usually also include cognitive therapy, physical rehabilitation, assessment of activities of daily living, as well as assistance or support for the availability of assistive device if the patient needs them to be able to move independently. Okay, next type of therapy for autism children, yeah, autistic children, yeah, is called floor time, yeah, floor time, yeah, is another type of therapy for children with autism, which was first introduced by Dr. Stanley Greenspan. Yeah. Floor time is basically play therapy because the focus of therapy activities is to invite children to play, to stimulate, yeah, the development of children's intelligence and emotions. Okay, but in the therapy, the child will determine what games he wants to play according to his ideas and interests. Children can give directions, but when parents follow these directions, parents can challenge children so that their intelligence is stimulated. With floor time carried out especially by parents of children with autism, children will experience several of these benefits. Creativity is increased through drawing and composing stories as well as elements of imagination, feeling appreciated, loved, accepted, more empathetic and more confident. Fine and gross motor skill improve. Sensory potential is increased, especially with the involvement of the seven sense system. Have a mental character that is developing in the healthy manner. Okay, and also experiencing emotional closeness with parents, yeah, increase ability in logical thinking and problem solving, yeah, and all improve communication skill, especially receptively, expressively, verbally, and non-verbally. Yeah, for time is a therapy that parents and children can do every day with a duration of 20 until 30 minutes per day so that they wake up in healthier way. Okay, next types of therapy for autism children is called visual therapy. Yeah, what does it mean? Yeah, visual therapy is a therapy that utilizes the PECS or picture exchange communication, yeah, picture exchange communication, yeah, method, yeah, as well as the use of video learning methods. Autistic children are usually rich in imagination, so that the process of understanding them will much easier. Through visualization, children with autism are expected to be able to improve their communication skills as well as improve their skills. Videos that are usually used to treat autistic children are video modeling, video games, or other electronic communication system according to the interests and choices of the therapist. Next, the therapy for autistic children is called physical therapy. Yeah, physical therapy or yeah, physical therapy also one of the therapies for children with autism that aims to improve motor skills. Yeah, children with autism usually have a pervasive developmental disorder in which brain development is slower and motor skills are also hampered. Physical therapy will help with this, including improving the child's body's coordination skills, basic sport skill, and developing muscle strength. And next therapy for autism children is called verbal behavior intervention. Yeah, what does it mean? Verbal behavior intervention. Yeah, is communication intervention. Okay, it's a type of therapy that is commonly taken by children with autism spectrum disorders. The purpose of this therapy is almost the same as several other therapies, namely to improve communication skills and behavior of autistic verbally and non-verbally. Autistic children who have difficulty speaking due to language problems and communication skills can experience development after going through this therapy. Children with autism who need communication intervention as one of initial therapies are those who experience inappropriate use of words, limitations in the use of words, the use of the same sentence, phrase or word over and over again, inability to initiate or continue a conversation with others, and also inability to talk to other people, where these problems are often not realized by parents as an obstacle for children to behave. This condition also makes children's socialization skill very less and results in children's quality of life is not optimal. Therefore, communication therapy is needed by children with autism. The next type of autism children therapy is called sensory integration therapy. What does that mean? Sensory integration therapy. In children with autism, the development of sensory integration may be impaired. This can have negative effect on child's behavior and learning process. Sensory integration itself is a brain process in organizing and interpreting sensory information received from outside the body, including taste, smell, sound, sight, movement, and touch. Through sensory integration therapy, children with autism will receive sensory stimulation, repeatedly and gradually but structure so that learning abilities and behavior will develop well. Not only that, this therapy is very helpful for children in processing sensory information obtained by their brain normally. If sensory integration therapy has been passed by the child, this will usually be followed by occupational therapy. But actually, sensory integration therapy can be done at home where parents and caregivers work together to create certain activities related to this therapy. After that, the child can undergo occupational therapy with the help of a professional therapist in this field. Next, autism therapy is called early intensive behavioral intervention therapy, or called EIBI. Children with autism, with early intensive behavioral intervention, especially at the age of toddlers, can undergo EIBI therapy, which is a therapy which applies a structured method with the involvement of parents and other close family members. EIBI is a type of therapy that has high effectiveness in improving children's ability to have good basic behavior. Over the course of this therapy, the child can respond to calls or voices from other people and can even at least talk to their parents when asking for something. The development of abilities and behavior of children with autism can occur quite quickly using this therapy. And next therapy for autism children is called discrete trial training, or DTT therapy. Okay, DTT therapy or discrete trial training is classified as behavioral therapy, which is also quite effective for people with autism. Autistic children's basic skill can be improved by utilizing the use of objects that are close and easy around them. Children's learning intermediaries in this therapy usually only use toys or food around the child. For example, when they want to focus on teaching the color red, yeah, when they want to focus on teaching color red, okay, the therapist can ask the child to the point or to get red food or toys. In DDT therapy, the following are some examples. In DDT therapy, the following are some of the abilities that children generally gain from undergoing DTT therapy. Okay. In flowing DDT therapy consists of perform simple daily independent activities such as using eating utensils or when they have to dress themselves. Yeah. And second one, yeah, DDT therapy, right well, yeah. Sit therapy, DDT therapy, speak, interact with others clearly and better. And the fourth DDT therapy, yeah, speak and interact with others and clearly and better. The therapist in this case will provide a gift as reward for the child's effort. When appreciated, the child will find it easier to remember the things he has learned from therapy. Usually, DDT therapy needs to repeat it so that children can more easily and quickly master these abilities. Okay, guys, uh, or you who have autism children, how you uh, remind and have knowledge much more about autism children, yeah, for your library, yeah. Okay, hope you give me subscribe for more, yeah. Have a nice weekend and bye bye.